Dental Care and Heart Disease by Thomas E. Payton. I'm located here in Aiken, South Carolina. My phone number is 803-649-5558. You can like us on Facebook, PaytonCosmeticDentistry.com. Brief outline: gum disease and how it relates to the heart, stages of gum disease, prevention, the view, and then questions afterwards. Start with a small video here that will be talk about gum disease and how that is related, and it'll get us started.
Some studies show that people with periodontal disease have a greater possibility of being diagnosed with heart disease than those without periodontal disease. Researchers suspect that's because inflammation is a characteristic of both periodontal and heart disease. Bleeding gums, a sign of periodontal disease, are open wounds that allow the bacteria to enter your bloodstream. One cause of heart disease is a buildup of plaque in the arteries that, over time, can restrict the flow of blood. Periodontal bacteria have been found in that plaque, which leads many researchers to believe there might be a relationship. In addition to building up, the plaque in the arteries can rupture, forming a clot. The clot can block blood flow and trigger a heart attack. The same thing can happen in your brain. If the bacteria settle in your carotid artery, the inflammation may lead to the buildup of fatty deposits. And if these deposits break apart and are carried away in your bloodstream, they can lodge in your brain, block a blood vessel, and cause a stroke. You may also be at risk if you've had damage to your heart or heart valve, certain congenital defects, a history of endocarditis, an artificial heart or heart valve, or have had a heart transplant. We want to work with you and your physician to keep you in optimal health, and a healthy mouth is a key to a healthy life.
So, the key words I want you to remember from that video is that bleeding gums, which is a sign of gum disease, are open wounds, and these are doorways for germs to enter your bloodstream and affect other parts of your body. Inflammation, which is a characteristic of gum disease and heart disease, and plaque. Plaque is the buildup that builds up in the arteries, which is one of the causes of heart disease. But when germs enter through the gateway into your bloodstream, the germs itself can stick to the plaque that are in the arteries, and buildup of the plaque with the germs on them can break off, and if they break off and lodge inside the brain, then this can cause strokes, or if it lodges inside the heart, then it can cause a heart attack. So, when you think about bleeding gums, I want you to start thinking about bleeding gums, which is a form of what? Gum disease. They're open wounds, and in these wounds there are gateways so that bacteria can go into your circulatory system. This bacteria can stick to these fatty deposits or the plaque that is inside these arteries. They can grow there. Your body will recognize it and cause inflammation and have an attempt to try to get rid of it. So these plaques can break off. Some of them can go to your brain. That will cause a stroke. Some can go to your heart. That can cause a heart attack. Some can wind up in the liver or into your lungs. Bleeding gums is now also linked to other health concerns, and these include lung disease, Alzheimer's. We already talked about stroke, but diabetes, colon cancer, obesity, and premature birth. So bleeding gums, again, bleeding gums are what? It's a sign of gum disease. When you have it, there's an open doorway whereby germs can come into your bloodstream and can cause other things within your body. Severe periodontal infections, untreated, may increase the risk of arteriosclerosis-induced conditions such as coronary heart disease. The same principle. The bacteria, again, bleeding gums is a sign of what? Gum disease. Open doorway. So start thinking about open doorway, whereby germs can come into your body and can go to some of these other organs inside of your body. Now, it's been known for years and for decades that people who have had rheumatic fever as a child, their valves inside their heart was damaged or scarred. Is a better way to put it. And what happens is that if you have a dental procedure and you've had a history of rheumatic fever, you have to be put on antibiotics before treatment, because once we begin to clean your teeth, then the germs can get inside your bloodstream, travel to your heart, attach to the valves, and begin to grow there. And if that happens, then you can get into a heart attack because the heart will not be able to function. So I'll show you a little small video on that, so it can try to paint home that picture for you, so that you, those that you do know that have rheumatic fever.
The mitral valve is located between the upper left heart chamber, left atrium, and the lower left heart chamber, left ventricle. A healthy mitral valve keeps your blood moving in the right direction. A leaky valve doesn't close the way it should, allowing some blood to flow backward into the left atrium. If left untreated, a leaky valve could lead to heart failure.
There you have it. So, the first stages of gum disease is bleeding gums. And what we as dentists, we look for in terms of a healthy gum is 1 to 3 millimeters when we probe. Probing meaning this is a probe, and we try to check the depths between the tooth and the gum to see how deep that depth is. Pockets is one of these areas, is what we call it if the depths are too deep. When we have probing of 4 to 5 millimeters, we term that mild periodontitis or mild gum disease, and associated with that is usually have some calculus that has to be removed. So how does this look in the real mouth? If you have bleeding gums, then this kind of how you're going to look. Bleeding gums when you brush and floss, remember, it's an open doorway. Right? Germs can get into your bloodstream, and if you have hypertension, if you have diabetes, you are at risk of heart disease in terms of having a heart attack due to strokes and a couple other things there. Bleeding gums also produces bad breath, particularly in those that have moderate periodontitis or severe periodontitis. The pockets are deeper in severe, 8 millimeters or above, and in moderate 6 to 7. Usually 6 to 7 can have gum surgery. We can pretty much save the tooth with this kind of procedure with surgery, but once we get above 8 millimeters, chances are you're going to lose the tooth. And when we talk about pockets and 8 millimeters, this is an indication about what the destruction does. The bone has just completely disappeared from this surface of the root. You can almost see the end of the root. This is a severe periodontitis. Plaque or bacteria on the end of the root. This is kind of how it looks. This patient is having gum surgery performed, and they took a picture of it to show the patient how the plaque actually is still stuck. You're not able to clean this, and that's why the destruction continued. It has to be professionally done to get it cleaned. In advanced periodontitis or advanced periodontal disease, you still have the bleeding gums. Remember, you got the open wounds. You think this person have germs? Yes. You think this person is at risk? Yes. And I find this a lot in the elderly, but I'm beginning to, for the last 10 years, I've been seeing it more in younger people. 30, some as young as children. It's just total neglect. Bleeding gums again? Yes. Open wounds? Yes. Open doorway, yes. So you need to start educating those that you know, because it could save their lives now that you know what the risk could be. Tell me what you think. Bleeding gums? Yes. Open wounds? Yes. Germs? Yes. Risk to their body. So, what does healthy gums look like? I'm going to go through a small little video that talks about that. But what we're looking for is good pink gums, firm, no bleeding upon touch or flossing or brushing, 1 to 3 millimeters sulcuses around the tooth. Okay? So it takes about a minute for this to show.
This video is an example of healthy gums and the sulcus that goes around the gums that a dentist looks at. We're looking at gum tissue that's pink, firm, and doesn't bleed upon touching. And there's a little moat that goes around the outside of the tooth, and generally a 1 millimeter to 3 millimeter moat is, or sulcus depth, is what's considered healthy. And that can get larger, and here's a periodontal probe that a patient shouldn't be using because you don't want to hurt yourself, but a dentist does, and you can see that right there it goes into 2 millimeters, and here it is a little bit less. And actually you can see the probe underneath the gum tissue in this case because she has a more translucent gum tissue there, and the probe will mark up to 2 millimeters for this particular patient. When we look at the depths on the periodontal probe, you can see the 1 millimeter, 2 millimeter, and 7 millimeter depths. And I'm going to show you an example of somebody that has a larger amount of bone loss around the tooth. This is further back in the patient's mouth. It's irritated, and the patient's going to need to either have it professionally cleaned up underneath it, and that's about 2 millimeters there. And as we go around that pocket or sulcus, it's 1 millimeter, and you'll see that the gum tissue there is not very deep, and it's just irritated and needed more stimulation. Here, on the other hand, is a patient that had come in. It's the exact same tooth in terms of location, but you can see like a popcorn kernel and food, and then there was a very rough filling there. And the filling was removed, and after cleaning it for 3 months, you can see that's very clean. But when you lose bone around a tooth, in this case, you can see it's 5, there you go, 7 millimeter pocket right there. That bone is always going to be gone. And even though the patient is able to keep it relatively clean and tight, the likelihood of that needing some sort of other periodontal therapy is pretty high.
Okay, so that talks briefly about what we as dentists look for. And so with healthy gums, this is a patient we did about 15 years ago. She wanted crowns and a nice smile in her 50s. She's about 62, 63 now. The gums are still nice and pink, healthy and firm. And that's kind of how we would like to try to keep them. Other patients of color, again, dark melanin, that's just pigmentation like our skins, but just want to show you how nice and healthy they can look when they're brushed and flossed properly. Nice firm tissue, will not bleed upon touch, and you can tell that this patient has very immaculate hygiene. Others that don't like the melanin on their gums, and they attempt to try to have it removed. So, how do you prevent gum disease? Simply by brushing and flossing, and you visit your dentist every 6 months. So, a small video on brushing and flossing takes about a minute.
How to brush your teeth. This will only take a few minutes each day, but will help keep your teeth and gums healthy. Brushing helps to remove the plaque that forms on your teeth every day. If the plaque is not removed, it forms acid. This causes teeth to decay and gums to become infected. When brushing your teeth, it is a good idea to use a brush with soft bristles, which is gentle on your gums. First, brush the chewing surface of your teeth with a back and forth motion to remove food particles. Next, gently brush your teeth in a circular motion with the bristles at a 45-degree angle towards the gum. Do the same on the inner surfaces of your upper teeth. Then repeat these same steps on your lower teeth. After brushing, rinse your mouth and check to see if you've missed any places. Remember to take time to brush and floss your teeth properly every day. Floss. Proper brushing and flossing is important for maintaining healthy teeth and gums. This will take a few minutes each day, but will help keep your teeth and gums healthy. Flossing helps to remove the plaque that forms on your teeth every day. Flossing removes plaque where a toothbrush cannot reach. These areas are along the gum line and between your teeth. If the plaque is not removed, it forms acid. This causes teeth to decay and gums to become infected. To floss your teeth, start by taking about 12 inches of floss. Slide the floss between your teeth, curving around each tooth, making a C shape. Make 3 scoops on each side of every tooth, going slightly under the gum line. Repeat this process with the lower teeth. Don't forget to floss behind your back teeth. Remember to take time to brush and floss your teeth properly every day to keep your teeth and gums healthy.
Well, there you have it. So brushing and flossing is one of the ways to prevent gum disease or bleeding gums. The View. Whoopi states, Goldberg, gum disease will kill you. I didn't say it. She's going to say it. So let's see what she has to say, and let's hear to what she says, and hopefully it will help somebody out there. There it is. Gum disease can kill.
Welcome to The View, and boy, am I glad to be back.
Yeah, we missed you. We missed you yesterday.
I missed you guys. I tell you.
You look better today, I
feel much better today. Emergency gum surgery.
You had the chipmunk cheek.
I had the chipmunk cheek, and whenever you get an infection in your face and it alters the way you look, people do this. I came into work yesterday, and everyone looked and said, "Hey! How are you?" My face was out there.
It was really out to you.
I'm not feeling as good as I should.
Your face was so swollen, she couldn't look down to even dial the phone.
Yeah.
And you tried not to have...
Joan Rivers' face, you know?
But you tried not to...
She can't look down either, poor thing.
When Whoopi came through, it's like you tried not to have the horror on your face, because you're just like, what? I'm okay.
Who beat you? Because it looked like I got beat up.
It did.
But I tell you again, I said it when I discovered all the minutia in my mouth. Take care of your teeth. And I'm embarrassed to say this to people. I have great dental insurance, and I did nothing with it. For years and years, I let my mouth go, and I am paying the price. I'm losing teeth because I'm losing bone. And I brought this on myself because I could have prevented it. And it is your mouth is connected to your entire system, your immune system. Right. If you do not take care of your mouth, you are not taking care of your body, and it will kill you.
What?
As you saw, I don't know whether you guys know this, but about a week ago, they finally linked mouth health to heart health.
Yeah. Gum disease can cause...
They're now having... I talked to a good family friend, and he's a dentist, and he said that for the first time in a long time, the physicians are actually connecting now. You have cardiologists speaking to dentists and physicians dealing with oral care, and there's a good conversation going on between the two medical fields, which is great.
You know, listen, if you're a certain age, we didn't go to dentists who cared about how we felt, okay? They went in your mouth, and that no gum, no sweetness. Dentistry has changed so much that it is really, they can do it, they can take care of it. It will be easier for you to teach your kids and grandkids again. I'm begging you, save your own life. Don't do what I've done, because I'm going to lose my teeth. Okay, and when it happens, I will let you know what's going on, because they will be fake in my mouth.
And there is no tooth fairy for adults. There's no tooth fairy for adults, so there's no fun part of that.
Yet, there's no tooth fairy yet.
There you have it. Do you believe it? Yes, Oprah said it. It can kill you. So if you haven't made an appointment with your dentist lately, if you do have bleeding gums and you know someone that has bleeding gums, then share this with them. Bleeding gums are open wounds. Those open wounds is an open door for germs that can come into your body. And if you're at risk if you have high heart disease, you're at risk of strokes. You have diabetes, you're at risk if you found that these germs have been attached. Actually, these are links. Again, colon cancer, knee and hip replacements, even dental implants are all at risk. So visit your dentist if you have the bleeding gums and get them treated. You should see your dentist every 6 months, in some cases with severe gum disease every 3 months. Brush and floss after every meal. Mess them up, clean them up is one of the things that we teach in our office. And I routinely give antibiotics for people that are in severe dental disease and or that has infections and need extractions. Alright, so the key words again is what? Bleeding gums are open wounds, and these are doorways for germs to enter into your bloodstream. Okay? Bleeding gums are open wounds, and it's a doorway for germs that can enter into your bloodstream. Okay? And also, one other thing is to remember that those germs will stick to the plaque that's in your arteries. The germs will stick to the plaque. The plaque build up in your arteries, the germs will stick to them, and that promotes other problems, the inflammation and everything else. Okay? Alright, I hope you've enjoyed the video. I hope I've given you something to talk about the next time you hear someone talk about, child, my gums were bleeding. Well, you let them know that there's an open doorway for germs that can get right into your bloodstream. By the way, do you have hypertension? Well, you're very high risk for strokes and other problems that's associated with that. If I can help you, please give me a call at 803-649-5558. My name again is Dr. Thomas E. Payton. I'm here in Aiken, South Carolina, 154 Pendleton Street, Northwest. And you can like us on Facebook at PaytonCosmeticDentistry.com. Thank you for your time, and I hope this has been a blessing for you.